Hi, I'm Harlan Krumholz. The topic today is sleep. Look, that's that kind of final frontier, something we're learning much more about, and I believe has great relevance for clinical practice today. I can't remember hearing much about sleep in my medical training. All I remember is that we didn't get much of it. I think back to residency and we prided ourselves on how little sleep we needed and how well we could function. Probably a bit of a delusion. It's ironic, though, that sleep today is being increasingly recognized as being so important to health. I think back to those days. We never would have thought about smoking cigarettes, walking around with a pack of cigarettes, but yet we would brag about sleep deprivation, and yet we didn't recognize it as a risk factor or the toxicity that it could cause. There's some recent studies of note that are really highlighting this issue around sleep and really making the case that we should be including this in our clinical practice. First, there are a couple of small but really well done studies that are bringing into focus the role of sleep and calorie consumption and obesity. In one published in JAMA Internal Medicine, Tasali and colleagues randomized 80 adults. Now, these people were a bit overweight, 25 to 30, just a little, and they slept on average about 6.5 hours a night. So this is a group that's overweight, maybe bordering on obese, and not sleeping, so many hours a night, 6.5. That's probably, by the way, close to national average. And what they did was they did a 2-week intervention, which sought to take half of them and to see if they could get them to sleep longer, and then would test the effect of that on calorie consumption and weight. So what they did was that sleep extension, they start to get out to maybe even 8.5 hours. So what they were able to accomplish was to get that group randomized to that intervention to add about an hour and a little bit more to their sleep every night. And what they observed was that over that 2-week period, again, there's no diet intervention here, it's just about sleep, but they're observing their dietary habits. And they saw that the people who slept a little bit longer, on average, consumed about almost 300 fewer calories a day. So, not insignificant really. And in addition, that group that slept a little bit longer lost, just in those 2 weeks, 1 kilogram. Meanwhile, the control group, which just continued on its usual habits, actually gained about half a kilogram. So there was a distance there between the two groups. Interesting. They wrote, the findings highlight the importance of improving and maintaining adequate sleep duration as a public health target for obesity prevention and increasing awareness about the benefits of this sort of adequate sleep duration for healthy weight maintenance. Now, there was another study that caught my attention that was very much related to this, took a little different approach. This was published in the Journal of the American College of Cardiology. First author Kovasin and colleagues had 12 healthy people aged 19 to 39 years participate in a randomized control crossover study. This was a 21-day, 3-week study. And what they did was they had people restrict to about 4 hours of sleep a night versus what they usually did, their control sleep. It's kind of the opposite of the prior study, where the intervention was about getting people to sleep longer. This intervention was about getting them for some time in the crossover to sleep less. Now, again, interestingly, this is a sleep intervention study. There's no guidance here about diet, but what they're doing is studying people's dietary habits or seeing what they've consumed, what happens to their weight. And what they saw was with this sleep deprivation, getting down to about 4 hours a night, during those time, people consumed more calories, about 300 calories a day again, with more protein and fat. Now, the weight didn't change a lot. Again, this is a pretty short-term study, but the total body fat didn't change, but the abdominal fat increased. That was both subcutaneous and visceral fat deposits. So this again is showing you that the amount you sleep is very much affecting both desire for food and also the way fat's being distributed within the body. Very interesting. And then there was an extraordinary study in Nature Aging that just came out. This addressed the optimal sleep time based on data on brain structure, mental health, and cognitive function from the UK Biobank. Now, this group looked at a whole range of different domains and metrics, and what they found was a nonlinear association between sleep and these various domains of health. It was kind of a Goldilocks effect. That is, there was a part that was just right. Too little, too much, not associated with as good a health as the sweet spot. And where was that sweet spot? just about 7 hours. That was the magic number. Now, this was self-reported sleep, but in almost every case, this amount of time, the 7 hours mark, was really just the right time for cognitive function, mental health, and brain structure. They said our findings emphasize the importance of sleep regulation for cognition, mental health, and the well-being of adults. And I think these are very important studies. It needs to be validated. That was mostly a white population. It was in the UK, but it's showing us that actually the right amount of time for sleep is associated with lots of other domains of health. And it's pointing our attention to just how important this is. So then our group led a study, Cesar Carballo was first author, that investigated whether there were sleep differences by race and ethnicity in the United States. What we were wondering is that as emerging information is suggesting to us that sometime, between 7 and 9 hours, the UK Biobank says actually 7 hours is the right amount. Are there differences that might be contributing to the health disparities we're seeing in this country? So if optimal sleep duration is so important, how's it break down by race? So we did a study of about 400,000 people over about a 15-year period. And we found that over time, people who were reporting less than that 7 hours, less than that optimal amount, Black Americans had a higher chance of that less sleep than did white Americans. And that difference persisted across the entire spectrum of those 15 years. And those differences start to emerge actually in early adulthood, so that you start to see this split early. We're also seeing that Black Americans were more likely to have longer sleep. And all of this may be contributing to health disparities, may be caused by some of the disparities as well. But it's something that we might want to be focusing on and learning about and understanding about how it's differentially affecting different groups. So overall, maybe we're evolving towards a greater appreciation of sleep as a key contributor to health. Well, that might not be news to you, but as this information is emerging, we're seeing more and more evidence around its effect on weight, on appetite, on lots of domains of health. And that UK Biobank study is suggesting, yeah, we should maybe be pointing people towards this idea of 7 hours if they can, admitting that there's likely heterogeneity within the populations, but maybe on average that 7 hours is just about the right point. Well, we'll see as more information comes out, but it makes sense. And if we want to fight obesity and inequities, and if we want to be in a position where we're promoting wellness and better cognitive function and mental health, maybe it's time to include in our discussions with our patients this issue about their sleep duration. Maybe we should be collecting this on every visit. And maybe our counseling should be focusing on this also as an intervention each individual can make that might make their lives a little better. It might improve their health.